Hi, welcome back to We See With Our Brains. A while ago I made a video about convergence insufficiency, which is the commonest binocular vision problem I see in my clinic. Today I'd like to talk about one of the least common, but probably one of the most overlooked, divergence insufficiency. If you remember, in convergence insufficiency, the eyes struggle to turn inwards for close work. Divergence insufficiency is almost the exact opposite. Instead of struggling to turn inwards towards something that's close, the eyes struggle to turn outwards enough when looking into the distance. Now, that might sound like a very small problem, but it can have a surprisingly large impact on everyday life. When we look at something close to us, perhaps a book or a phone, our eyes have to turn inwards so that both eyes are pointing at exactly the same place. That's convergence. As we look further away, the opposite happens. The eyes relax and move outwards so that they remain perfectly aligned with the distant object. That outward movement is called divergence. For most people, this happens automatically without any conscious effort. But if someone has a divergence insufficiency, they don't have quite enough divergence available to keep both eyes comfortably aligned when looking far away. Their divergence is, as the name suggests, insufficient. As a result, they may have to work much harder to keep clear single vision when attending to something in the distance, or they may not even be able to keep it single at all. So what sort of symptoms would someone experience? The most common symptom is double vision when looking at something in the distance. Interestingly, most people with a divergence insufficiency can read perfectly comfortably close up. They only experience problems when looking across a room, watching television, driving, reading road signs, or watching live sport like football or cricket match. One person came to see me because they noticed they were experiencing double vision when trying to aim a bowling ball, playing 10-pin bowling with their kids. They had almost double the number of pins. Sometimes people with a divergence insufficiency don't actually see double. Instead, they describe the vision as blurry, unstable, or as if it comes and goes, and often the symptoms are intermittent, so the patient forgets to mention it or doesn't feel like it's worth mentioning. What might a divergence insufficiency look like in the classroom? Well, let's imagine a child sitting near the back of the class. They're trying to copy some work from the whiteboard into their exercise book. Every time they look up at the board, their eyes have to relax from their reading position and accurately align in the distance. If they have a divergence insufficiency, they may briefly see two whiteboards, or the words may merge together before they become clear again. By the time the image settles, the rest of the class has steamed ahead. The child may lose their place repeatedly, copy the wrong line, or simply avoid looking up altogether. And because they can read normally at their desk, nobody thinks to investigate a distance binocular vision problem. Teachers most often report to parents that these children are distracted or not concentrating because that's exactly what it looks like. The child, who doesn't realise that everyone else's vision stays comfortably single all the time, buys into this and may internalise that they are naughty, lazy, or worse, stupid. And what about adults? Adults, as I've said in previous videos, mostly come to my clinic with driving problems. Imagine driving down a motorway. You're constantly shifting your focus between the road ahead, mirrors, dashboard, and distant road signs. Someone with a divergence insufficiency may find that road signs briefly split into two images before they become single. The number plates of cars further ahead may appear double. Overhead motorway signs can become difficult to read until they're much closer. Some people even begin to avoid driving at night altogether because they lose confidence in what they're seeing. Both the adult and the child, or their parents, in these two examples, might seek an eye examination, but because the symptoms are often intermittent or only present in certain conditions, such as when the eyes are tired or when driving in poor light, they're often missed. The reason for this is that most routine eye examinations don't place a great deal of emphasis on measuring distance divergence ranges. So to explain, if you think of your binocular vision system as having a reserve fuel tank, most of us have enough divergence reserves to cope with tiny misalignment errors without us ever noticing them. In patients with a divergence insufficiency, that reserve fuel tank is much smaller, so everyday visual tasks use it up far more quickly, and the symptoms only occur when the reserve tank is drained. So in a normal 20-minute eye examination, if someone can read the test chart and their eye health appears normal, it's easy to assume that everything is fine, unless the patient specifically mentions double vision in the distance or the clinician performs a detailed binocular vision assessment. The diagnosis can be easily missed. I'm definitely not throwing shade at our optometry colleagues here. An NHS eye examination has neither the time nor the funding for a nuanced look at how a binocular vision system functions over a prolonged period of time. To make matters more difficult, many patients don't even report double vision. They say vague things like, "It's a bit blurry," or "The letters take a second to come into focus." "It becomes clearer if I blink," or "I can read it but it's not clear." Many people with a divergence insufficiency never even describe seeing two images. Their brain suppresses one image just enough so that they simply experience blur or instability instead. And that's why it can be so difficult to spot in a busy clinic. I'm going to take a brief detour here and mention two important conditions which can be confused with divergence insufficiency, because it's not the only condition that can cause double vision or other weird symptoms in the distance. The first condition is a sixth cranial nerve palsy. The sixth cranial nerve controls the lateral rectus muscle, which is the muscle responsible for moving the eye outwards. There's one on each side here and here. If that nerve isn't working properly, the eye physically cannot move normally. People with a sixth nerve palsy often develop horizontal double vision that's worse when looking into the distance and even worse when looking towards the affected side. The second condition is called divergence paralysis, where the eyes suddenly lose the ability to diverge, often because of a neurological problem affecting the brainstem or some other part of the nervous system. Both of these conditions require prompt medical investigation. If you or someone you know develops a sudden onset of double vision, particularly if it's associated with reduced eye movements, facial weakness, imbalance, headaches, or other neurological symptoms, they should be examined by a neurologist or a neuro-ophthalmologist. One of my most important jobs is recognising when a patient has a binocular vision problem that I can manage and when the findings suggest that it's something requiring onward referral to the hospital. Assuming our patient, assuming their symptoms are regular old divergence insufficiency, what might cause it? Well, there isn't just one cause. Of course there isn't just one cause. The most common reason, though, is uncorrected long-sightedness or hypermetropia. People who are long-sighted often have to use extra focusing effort, even for distance vision. Focusing, or accommodation as we call it, and vergence, those in and out movements of the eyes, are neurologically linked. Whenever we increase our focusing effort, we also stimulate a little extra convergence. If someone is constantly over-focusing because their long-sightedness hasn't been corrected, they may also be generating unnecessary convergence. And that extra convergence makes it even harder for their eyes to relax into the more divergent posture needed for comfortable distance vision. Correcting the long-sightedness often reduces that unnecessary focusing effort and allows the binocular vision system to relax, which corrects the divergence insufficiency and relieves the symptoms. Interestingly, the same thing can happen with people who are myopic or short-sighted if their glasses are overcorrected. If a myopic prescription is made slightly too strong, the patient effectively has to focus more than they should to overcome the prescription and obtain clear distance vision. Again, that extra focusing stimulates extra convergence, which can aggravate a divergence problem. But even accurately corrected short-sighted people can have a divergence insufficiency because people can have two separate problems: a refractive error, that means they're short-sighted, and a binocular vision problem as well. In this instance, correcting the refractive error may remove one source of eye strain, but the underlying binocular vision disorder still exists. That's why a full binocular vision assessment is so important. One more thing though. Although divergence insufficiency can occur at any age, it's much more common in later life, and there are several reasons for this. Firstly, the muscles and the connective tissues around the eyes gradually change with age. Like the rest of our body, they lose some flexibility and efficiency. Secondly, the brain's ability to compensate for any small alignment errors also becomes less effective over time. The reserve fuel tank I mentioned earlier depletes with age. A small problem that was completely compensated for at age 40 may begin producing symptoms age 60 or 70. There's also another condition, age-related, known rather attractively as sagging eye syndrome, in which the connective tissues supporting the eye muscles gradually stretch, and this can produce a small inward deviation of the eyes at distance, and it's now recognised as one of the more common causes of acquired distance double vision in older adults. So how do we treat divergence insufficiency? Well, first let me say that treatment is mostly very successful. The first step is to make sure that the glasses prescription is accurate. If someone is long-sighted, correcting the hypermetropia may reduce unnecessary accommodative convergence. If a myopic prescription is slightly overcorrected, reducing it to the correct level may significantly improve comfort. For many patients, this is enough to stop their symptoms. Job done. For those cases where symptoms persist, the most effective treatment is optical prism. Optical prisms bend light before it enters the eye, effectively moving the image inwards a little so the eyes no longer have to move outwards as much to maintain clear single vision. Many patients experience immediate relief from double vision once the correct amount of prism has been prescribed. Vision therapy can also sometimes help, particularly in younger patients with mild divergence insufficiency and a good potential for improving their fusional divergence reserves. However, I prescribe spectacles, including prisms, far more often than I use vision therapy for this particular condition. As ever, the right treatment always depends on the individual patient, their age, the cause of the problem, and the findings from a full binocular vision assessment. That's a good place to wrap it up today. If you or your child is experiencing symptoms like these, it may be worth asking whether a detailed binocular vision assessment needs to be carried out. Sometimes the problem isn't how clearly each eye sees, it's how well the two eyes work together. Thanks for watching. If you enjoyed this, please click like to help the channel grow and hopefully help more people. And if you want to keep up to date with new videos, please subscribe to We See With Our Brains. I'll see you next time. Bye for now.